I am Andrew Ulrich, Vice Chair of Clinical Operations, Department of Emergency Medicine. The Yale New Haven Hospital and the entire health system have been very involved and working closely with the state and the federal government, the CDC, to identify the techniques, the tools, and the equipment that we need to ensure that our staff does all they can and protects themselves should they come in contact or a presumed exposure to somebody with coronavirus. We're working and have done a lot of work with identifying patients who, what we say, screen positive, or those who are at higher risk for having been exposed to the disease, and those that come in who have symptoms that are consistent with the disease, isolate them here within the department, put them in the correct place so that they're not in and around other patients. And then when our staff is working with them, wearing the correct protective devices, what we call PPE, so that when there's close contact with these patients, our staff is protected. We increase the degree of protection for our staff by putting on a stronger mask and eye shields and making sure that we're really gowned and protected when we have close contact with patients who are presumed to have or do have coronavirus. We're telling people that if you're sick, if you have symptoms that go along with this disease, to not go out, not come to work, isolate yourself if you have the symptoms. The symptoms are very similar to what we see with the flu. It is important that before anybody presents either to urgent care or to their primary care doctor or to the emergency department, you reach out first and ask and determine if there's something, if you really do need to be seen. And if I don't need to be seen, what should I do now if I have symptoms?